My name is Gregory Nuttall. I'm an anesthesiologist specifically. I'm a cardiovascular anesthesiologist with an interest in blood banking and blood transfusion. The title of our article is Computerized Barcode-Based Blood Identification System Detects an Increase in Near-Miss Transfusion Episodes. And I should also mention, if we can, the two other people that were very instrumental in this project are Jim Stubbs and John Abendstein. They both did a lot of the heavy work to make this happen. So. The manuscript describes an effort on the part of a large number of people at Mayo Clinic to try to increase safety of the patients. And it was done as we instituted a barcoding system that interacts with several computer systems within the Mayo Clinic Rochester that allows positive identification of the patients. We then developed computer program changes so that we could then identify the units of blood that have barcodes, and by electronic computer matching make sure that that is the appropriate unit for that particular individual patient. Later functionality was also added in that we also can confirm that it is the right blood type and the type of unit being given. This functionality of being able to look at the barcode and the patient and on the unit of blood was started around 2006, and so what we did is we did a study where we looked at 4 years before the institution of barcode and 4 years after the institution of barcode, and what we looked at is to see if we had an increased safety for the patients and reduce transfusion errors. And what we found was in the 4 years before the barcode institution, at that time, patients were, the blood units were identified by two providers who just basically looked at the patient's clinic number and made sure that it was appropriate with the clinic number on the bag of blood. What we found is that there were 388,000 units approximately administered, and in that we found 6 patients that got the wrong, were transfused the wrong unit of blood, and there was one near miss where they almost gave the blood to the patient but were stopped in time to prevent the transfusion. In the 4 years after the institution of the barcode scanning, we found that there were a little over 300,000 units that were administered, and we found only one episode where the wrong unit was administered to a patient, and then that particular situation, the person had hung the blood and then scanned the unit into the computer system. So the system actually wasn't even used properly in that particular situation. More interestingly, we found that there were now 34 episodes of near-miss transfusion episodes. Of those, 6 of them would have been hemolytic transfusion reactions. And that was a statistically significant increase in near-miss events. This is a part of an ongoing process where we're trying to improve transfusion safety and also patient safety. We now have closed the loop on the system so that now when the patient comes in, they're identified. When we take the blood for type and cross or type and screen, their barcode is scanned, and then actually we generate a barcode for the blood tube that the patient sends off to, we send off to the lab, and all the rest of the system is all computerized, so it's all self-checking to make sure that we don't make a mistake or a transfusion error. This actually is part of a larger number of research projects that we have ongoing. Actually, Dr. Mark Arith and Bill Oliver and I have a team of guys that do research in coagulation and transfusion, and we're doing all sorts of projects to try to improve the appropriateness of blood transfusion, reduce blood transfusions through use of drugs and other things. As I said, with all of this, though, it's also part of a bigger team. What's really important is, there's a large number of people that makes this stuff happen. This particular program was developed in Rochester and is only currently available in Rochester. I found out that we cannot transport it across state lines, but it is, in my mind, the ideal system that we should be, as a nation, striving towards to improve patient safety and prevent errors that harm patients.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.